It's one of the most precious times in life when nothing is supposed to go wrong.
We never wanted this diagnosis, but I look at my daughter and she is perfectly made. And she's wonderful, and I'm so grateful.
Erin Carr's baby girl Tess was born with a liver disease. Erin would soon learn so much about it, but what she didn't know would sometimes be terrifying to think about. She couldn't even speak its name.
It took a year before I could say alpha-1 out loud. I just said, well, you know the thing, because it felt like the boogeyman was going to get us, and I couldn't run fast enough.
Alpha-1 antitrypsin deficiency.
There it is. Those words parents like Erin hear for the first time.
For short, we call alpha-1. It's a genetic disease. It affects about 1 in 3,500 Americans. Their liver makes an abnormal kind of alpha-1. The liver has too much. The abnormal protein builds up in the liver. With alpha-1, most people are not diagnosed, or many people are misdiagnosed. Alpha-1 can cause a wide range of health problems, from childhood through old age. It can cause liver damage, it can cause lung disease in adults, and rarely can cause skin problems and other conditions. There's a small group of infants where the liver gets very, very sick. It can be life-threatening. Sometimes the child even needs a liver transplant to survive. We have documented a number of deaths nationwide from alpha-1.
From their home in North Carolina, Erin now travels with Tess once a year to see Dr. Jeffrey Teckman at SSM Cardinal Glennon Children's Hospital in St. Louis.
Her liver was sick soon after birth. She's done well, but we know from our studies that there's still a risk of liver damage and serious disease. It suffers from a lack of treatments, and that's what we're trying to do, develop new treatments where there are none.
Because of Dr. Teckman's leading role with a series of groundbreaking collaborative research, including the discovery of the first possible treatment for alpha-1, Erin can now say the name of the disease she so overwhelmingly feared.
We very likely will have either a treatment or a cure for this.
We now, fortunately, are at a point where multiple new drugs are entering treatment trials in 2024 and 2025. So it's very exciting.
At his St. Louis University School of Medicine laboratory, alpha-1 antitrypsin deficiency is his life's work, his mission. And because of all the research for new treatments that this professor of pediatrics and biochemistry and microbiology has done year after year, Erin can smile more, like she never could before. Tess is now 5 years old, in kindergarten.
If you didn't look at her lab work, you wouldn't know that anything is wrong.
And Erin has so much hope for Tess's future. But there was one more hurdle Dr. Teckman had to overcome that could have helped Erin handle her situation better 5 years ago when Tess was a baby.
I probably wouldn't have felt though the boogeyman was going to get us.
We have been unable to predict which infants and children would go on to life-threatening disease and which would do well. And as we test new drugs, it's very, very important.
Teckman went after that missing piece of the puzzle for families like Erin's.
It's a math problem, a mathematical method to predict who's going to do badly and who's going to do well.
It worked. Teckman is the senior author of a study successfully identifying biomarkers for severe alpha-1 liver disease in infants.
Can give us a prediction of small children that 10 years in the future might have life-threatening disease or not.
As a mom who just feels scared, knowledge is power. And it might not be the answer you want, but at least you can make a plan for your baby, for your child, to help take care of them versus just not knowing.
The next phase of Dr. Teckman's study is expected to help older children like Tess.
We have built an even more powerful model that will help us understand how kids do, which we're going to be working on for the rest of 2024 and into 2025. Hopefully that will be ready just about the time that children will need to be enrolled in some of these new drug treatment trials. I'm very optimistic that liver transplants and death from alpha-1 within the next few years will be a thing of the past. I think this is going to be a tremendous success story in medicine that we're going to be able to cure this disease, and we're going to be able to know who's going to get sick and who isn't, and why that is, and answer questions that we've been wondering about for 50 years.